more than just that average runny or stuffy nose, there might be a bigger problem lurking. We've got Dr. Marc Routman here with the ear, nose, and throat. He's an ear, nose, and throat doctor at Brookwood.
Right.
And could it be more than just sinusitis if people are still having problems with that all the time?
Well, that's what it could be, is sinusitis, but it could be just a blocked nose from bad structures inside.
Okay.
And we have a picture of the nose that we could show what the inside of the nose looks like to get everybody kind of started on that.
Let's see if we can bring that picture up here in just a second. A lot of folks are having problems this time of year regardless. There's a lot of people sniffling and sneezing. My mom's even doing it. She thinks it's either some allergies, but you know, it could be a variety of things.
It sure could be, and a lot of us have what everybody's maybe heard, a deviated septum.
Yeah.
And we have a picture on the screen here now that shows that deviated septum compared to the normal nose, and also some of the internal structures of the nose called turbinates that help warm and humidify the air, get it ready for the lungs. And these turbinates can grow extra big to take up space, and they're the things
Turbinates.
Yes, and they're the things that block your breathing when you get a head cold or an allergy attack, for that matter.
Huh.
Now, they can also get big when you have a sinus infection. In a sinus infection, of course, we expect to see some coming out of your nose, which would be yellow or green mucus. And 70% of the time, that pus is going to get better by itself in about a week. If it's not better in a week, then that's when you need to go see your doctor.
And get the Z-Pack?
I'm against Z-Packs because there's a 40% resistance rate by the bacteria against Z-Packs. And probably because they've been so overused because they're so convenient and easy.
I've gotten a sinus infection before, and somebody at work has gone and gotten a Z-Pack, and I've gotten well on my own in the same time they did with the Z-Pack.
Right, and the Z-Pack doesn't penetrate the sinuses well. And like I said, if you have a normal anatomical nose, it's going to drain and clear itself up most of the time within a week. And so instead of rushing to the doctor, as long as you're not running fever or having any severe symptoms, if you're just having a congested nose and some yellow and green mucus, you can go take some over-the-counter medications.
That's what I did.
And a lot of times that'll help get it better, and the pharmacist can help you pick out which medicines to take.
So how long should you go before you go and get some antibiotics?
Probably about a week to 10 days if it's not getting better. You know, depending on what you're doing, you know, if you got the big wedding, or you're going to go to the big football game, or flying on an airplane, you know, that could speed it up. But, you know, you can always be walking wounded, as I say, for a week's time.
And then go away.
And then go if it's not better at that point.
Good news. Okay.
Now, we also have a CAT scan showing an infection in the nose. If we could pull up that CAT scan. And as you see here in the CAT scan, on the one side, which is the right side, we see the black in the sinuses, which is all air. And on the left side, we see the gray in the sinuses, and that means that sinus was full of pus. And this man had actually had this infection for going on 2 months.
Ooh.
And he had taken a couple of Z-Packs and another couple of antibiotics, and nothing was getting it better. So this is when you need to have a surgery to open that sinus up, because it's not going to open up by itself.
Serious. Okay.
Yeah. And the surgeries nowadays are mostly done through the nostrils with endoscopes or balloons to open the sinuses.
Okay. Well, they can always call your office as well. And
be glad to talk to him.
Okay. Well, thank you very much.
Happy to be here. Nice to see you.
Dr. Routman, good to see you again. Hey, the